So I'm going to talk to you a little bit about angina. You'll see on the top of the screen here, you've got the black arrow. This is to show you the direction of the blood flow. This squiggly little worm here, this is our coronary blood vessels. Now these are blood vessels that supply the heart itself with its own blood supply. Now blood will be traveling down in the direction of the arrow, and obviously you can see it traveling here towards our heart. This heart is requiring sugars and oxygen to survive and function correctly. Now, with patients with angina, over a number of years, lifestyle choices, being overweight, smoking, etc., and high cholesterol, of course, as well, we can build up on the inner edge of the blood vessels atherosclerosis. There's all the fatty tissues and plaque that build up, and the lumen, which is the core, the center of the blood vessel, can become narrowed and constricted. So if our chap here or lady here exercises, and for a patient that suffers with significant angina, if they exercise, which could be getting up, going to the bathroom, to the toilet, they will increase the workload of the heart. It now needs to pump harder. They're now standing, perhaps, and they're exercising. The muscles around the body require more oxygen, so we need to push more blood around the body to supply that oxygen demand. So with our patient here, the blood vessels will be traveling along through the coronary arteries and supplying the heart with that demand. However, this atherosclerosis can be so constrictive along here, maybe up to 70%, that the demand required by the heart cannot be met, as the narrowing of the lumen there is too restrictive. So what these patients will do is typically they will stop what they're doing, reduce that demand for the oxygen, maybe sit back down again, and as the muscles reduce their demand, the pain that they cause into the chest there will slowly resolve. What these patients can also do is they can take their GTN spray. Now, GTN spray can work as a dilator. And if we take some GTN spray, let's get a larger pointer there, we can dilate these blood vessels, which makes them much wider. So we still have the plaque on the inside blood vessels there, but we now have much wider blood vessels, and this will allow the oxygen, the blood flow, to resume through that narrowing much more freely and supply the heart with the blood it requires. A couple of downsides to the GTN spray is it can cause patients to have significant headaches, and it can also cause complete vasodilation, and the patient will feel very dizzy and faint. And it is not uncommon for patients that take GTN spray to become unconscious through a faint as well. So as a first aider, you can support patients with their GTN sprays, but just be very aware that if you are to be spraying these sprays under the tongue, which we'll talk a little bit more later on this talk, just be very aware that the side effects could be feeling of faint, headaches, and even possible unconsciousness. However, this is typically quite brief, as the half-life, how long the drug works for in the body, is very short. So normally, if you lay them down, elevate those legs, the conscious levels will be restored very quickly.